Again, sorry about that, folks. And here's a great quote that I got. This is the physician to Alexander the Great. When health is absent, wisdom cannot reveal itself, art cannot become manifest, strength cannot fight, and wealth becomes useless, and intelligence cannot be applied. Okay, let's go on to the next one. I thought that was pretty cool. Our webinars usually revolve around three main things. The power of the human body. We know now more than ever before that our bodies have a lot more potential than we give them credit for. And unfortunately, too many people kind of they stumble over that fact so much, and it's like when you talk to them about this nutritional product or this intervention that can help them, they seem to be in total disbelief because it has never been in their realm of experience. Their doctors have never told them that, and so they like I said, they stumble over such things. However, it's not the nutrition itself that usually does the work, it is the body. And so if we can help people understand the way the body works, then hopefully that disbelief will be minimized and they'll be able to take better steps towards taking control of their health. Of course, we do need certain things for our bodies. Our bodies do not function on their own, just like a car. It doesn't matter how good the car is. It needs some vital nutrients. It needs vital components to help it work better. And of course, at the same time, we must protect our bodies as we go along. And I have in front of you at the screen here a picture of Dr. Sami. And last week, he did a wonderful, wonderful job with stress and heart health. And really, as he was going along, the whole idea was protecting yourself against emotional stress primarily. And I just couldn't help thinking, folks, that yes, stress is a factor, but sometimes people would leave thinking, well, that's all I need to do. I just need to protect myself from stress. And really, this came to a head when I thought about Dr. Harry, who came about 3 weeks ago, and he did a wonderful presentation again on arginine and the Nobel Prize-winning approach that helps to cleanse and unclog your blood vessels. And we're talking about the cardiovascular system tonight. But he, like I said, he did a great job on with talking about arginine, the nitric oxide pathway. But towards the end of his lecture, I asked him a question. I said, well, where does CoQ10? Many of you know that what that is. It's an antioxidant, but it's also very, very important for muscles, especially the heart muscle. And he said, well, he uses CoQ10. Well, that wasn't in the presentation. And of course, we asked him to come to present on a specific topic. But again, people who are just getting into nutrition might leave with the impression that, well, all I need to do is take arginine. Or in Dr. Steve's case, all I need to do is minimize my stress. And what I began to realize was that we need to show people that these are all pieces of the puzzle. Now, they are vital pieces of the puzzle, but they are pieces of the puzzle nonetheless. And so there had to be a full picture. Let's say the cover, the picture that comes with a jigsaw puzzle, the cover has that picture, and it shows you where everything goes. And so I began to think to myself that maybe we should do a class on the cardiovascular system and really show people how everything fits together. Now, that's a tall order, I know, because we only have about an hour and a half at most to do that. But we shall try, and then wherever we'll try and paint sketchy at best. But hopefully you're going to be able to see how these things all fit together. Now, again, when it comes to health, and I like to show this diagram. Some of you have seen it several times. When it comes to health, there are two main approaches, the medical approach on your right side and then the nutritional or the other integrative complementary medicine approach where folk medicine is one of those things. I mean, I come from a part of the world where in many parts of my country they haven't even seen a syringe or a needle before, and so they rely a lot on traditional medicine. And so far they've survived, maybe not too well, but they've survived and they've done well in some cases. And then, of course, on the right side is the medical approach. And listen, I'm going to be the last person, the very last person to slam the medical establishment. If you're from my part of the world and you're over the age of 5, I would say over 80% of people who are over the age of 5 are alive today because of medicine, the traditional, what we call allopathic medicine, and we just have a lot more to deal with. But that said, the problem with this approach is that it focuses solely on the symptom or the disease. Okay, we're talking about the cardiovascular system today, so let's use an example. Let's say cholesterol. The patient walks into the doctor's office. The doctor says you have a high blood cholesterol. Now that's becoming very controversial today, but anyway, let's say he has a high blood cholesterol. What does the doctor do? He throws anti-cholesterol medications at him. Well, let's look at some pictures. Come on. Okay. All right. So let's say these are anti-cholesterol drugs, and so they throw it at the disease. But at the same time, that if it does reduce the cholesterol medication, this doesn't happen 50% of the time, by the way. If it does, it also causes side effects, and those are what these mountains in the background are. Another word for that would be collateral damage. Okay, but again, as we're looking at that, we also realize that it not only causes other side effects, but it begins to chip at the mountain of this person's health. It's the other systems in the body, and we have about 12 or 13 of those systems, are also negatively affected when you use medications. What most people do not realize is that while they're taking this drug or whatever it is, they have to be aware of what that drug can do to their normal body, their normal body systems. And therefore, they should be educated so as to know how to protect and even build strength in these other cells so that they are not affected the way this one is being affected. Make sense?
Yes, that makes great sense.
Thank you. Well, the other approach would be day in, day out, and this is really your responsibility, and that's the mountain to your left, is to know the things that make for health, know the things that make for strength, and continually, day in, day out, supply your body, your mind and your spirit with those things that help to make you strong. And as you do that, you enjoy life more. But in many cases, it also helps to, if there is an underlying disease or symptom going on, a strong body has a way of taking care of the other problems. And even if you're on drugs, I tell you, having your body being given the right nutrients will help the drugs to work even better. And as I say this, I think about my mentor, my close friend, Dr. Rayburn Goen. And many of you know who that is. He's about 94 now. And 7-8 years ago, he stumbled across this nutrition, the power of nutrition. And what he was told, he had about 21 problems wrong with him. He had a very high cholesterol, close to about 400. He had cancer in one part of his body. Had all kinds of things wrong with him. All kinds of things. Anyway, what he did, he had been on like 8 or 9 medications. Well, when he realized this, he began to apply it for himself. He began to use the products, and use good nutrition. And what happened, and again, this is not a magic bullet thing, he found a way to use about 4 or 5 different products, and that helped to strengthen his body, strengthen his cells, so that in turn, his body would now be able to take care of those symptoms and of those diseases. And here's what happened. In about 4 months, and this is according to his own testimony, in about 4 months, 20 of those 21 things no longer bothered him. Now, if this had been someone on the streets and just said that, I would have said, well, you're trying to sell something. They probably paid you to do this. But if you know Dr. Goen, that is not possible, because he's very, very, very well off. He built one of the largest medical practices, private medical practices in the whole state. So he is very, very comfortable, and his kids also are very, very successful. So that is the truth, and that is what we're trying to get at here, folks. What we're trying to aim at is to help to build your cells, build your mind on a day-to-day basis, so that you don't have to fall prey to unnecessary ill health. This is one of my favorite quotes, because if we can focus, if we can remove ignorance, then hopefully people will be able to deal with complacency. And the reason why people are lazy and not doing what they need to do is because they really do not know what to do. And hopefully we'll be able to play our part in alleviating that problem. Okay. The issue with health, as always, is to focus not just on one aspect, but on several aspects. And, of course, we have this PNI slide that shows how your mind affects your brain, which affects your endocrine system. The endocrine system plays a huge part, by the way, folks, when it comes to the cardiovascular system. And we're going to get to that in not too long from now. The immune system, of course, plays a huge part. Question